my pregnancy showed that I had gestational diabetes, and I was so in denial of it, and I neglected myself for years. I tried different plans, they just didn't stick and work.
We're a multi-specialty team of providers that work with patients who either have chronic conditions or are at risk for chronic conditions, and they want to work on lifestyle modifications.
Liz, she came with open doors. There was nothing I can place on the table that she had judgment against, nothing that was challenging for her to have me understand that I can get through. She led me along the way, and everything was positive. Even when I wanted to give up, she wouldn't let me.
Patients, usually they're referred by either their primary care doctor or another specialist, but they usually either have a chronic condition like diabetes, prediabetes, high blood pressure, sleep apnea, or are at risk for them.
We are experts in understanding how behavior works and how to make behavior change possible. A lot of people know kind of what to do, but they struggle with how to actually make it happen in their lives. And then I will also work with people where part of the challenges they're facing are related to perhaps body image, eating concerns, anxiety, or mood.
My role in the Prevention Center is as a tobacco treatment specialist and clinical psychologist. So I tend to work with people who are working on quitting smoking, and then we come up with a personalized quit plan. So that could include counseling, it could include medications, but really it's tailored to them to help them to quit smoking and be successful at staying away from tobacco long term.
Our first visit, we typically get about an hour with a patient, and we can talk about different areas in your lifestyle to get a sense of areas of opportunity in either diet, physical activity, sleep, stress, mood, and your social connections. From there, come up with plans of what works for you, how we can make small tweaks or changes in order to improve your day-to-day lifestyle in order to reduce the risk of those chronic conditions. We work together primarily in the beginning on some lifestyle changes, simple things like increasing her water intake, increasing her fruit and vegetable intake, going to the gym, and getting better sleep. We changed up the medications to have it such that weight loss would be easier. She was able to lose 25 pounds in 6 months, and her A1C was the best it had ever been controlled since her diagnosis.
They prevent you from keeping the negative understanding of like, I can't do this. It's more like, oh, I can, because this team is dedicated to you. They literally operate and design the whole plan around you, and it's very helpful. I'm a success with it. I actually have practiced things with my kids as well, because my son was actually at the pre-diabetic range as well. He changed up some things, and I mean, we work out together, and I think it brought us together as a family more as well too, because we do work out together, we walk together, we spend activities together.